I am very excited to introduce our next guest, Dr. Jared Skowron. I have known him for, goodness gracious, I want to say 13 plus years.
That sounds about right.
And I have just watched you just continue to help this community in such a huge, huge way. And so for those watching, can you talk about a little bit of your background and how you got started in your practice?
Oh, sure, I'd love to. So I've been a biomedical doctor for over 15 years, and I really have found my life's mission in helping our kids with developmental issues, whether that be kids on the spectrum or ADHD, or regardless of the diagnosis. It's about helping our kids reach their full potential, making sure everybody gets to do as much as they can. So that's why I've been doing it, and 15 years has passed in a flash.
It felt like 15 minutes.
It feels like 15 minutes. But it's so rewarding. It's so rewarding that I love what I do, and I love helping kids, and I love helping families, and I'm lucky that what I do helps so many. So it's great.
And so where are you based out of?
So my physical practice is in Connecticut. One of the great things about the 21st century is we do so much telemedicine. So I get on the phone, I get on Skype, I talk to people around the country, I get to talk to people around the world. I mean, just this month I've talked to people in Romania and Singapore and Canada, and it's awesome because there's people everywhere who need help. So we can do that.
Mm-hmm. And so what I love about telemedicine is anybody that's watching right now, it doesn't matter what country you're in, you can contact a doctor like Dr. Jared Skowron, and he's right there at your fingertips.
Exactly.
And so today we're going to talk about detoxification and basically the subgroups of what that means, right? And so, just because you have autism doesn't mean that your pathways aren't detoxifying the right way. However, we do see a large, let's just say, portion or subgroup of our kiddos that they have autism, but they also have overlapping diagnoses of other stuff.
Sure.
And so one of the things that we see often for those in those groups is, for whatever reason, they're not detoxifying. So let's talk about first, what is detoxification? So for those watching, maybe they don't really understand that.
Sure. So it's such an important part of the majority of our kids to help them get better is to get the bad stuff out. And our body is constantly doing this on a minute-to-minute basis, okay? We need to make sure we bring good things in. That's good food, that's good nutrition, that's good lifestyle, that's good sleep, that's good water, good everything. We need to get the bad stuff out. Now, where does that bad stuff come from? That bad stuff is in the air. There's air pollution. It's in our food. It's in our water and our drinks. So there are toxins everywhere. And the job of our body is to make sure that we are getting rid of the stuff faster than we're bringing in the stuff. And some people can do it, and some people can't. And those people that can't, it's normally due to different types of it's genetics. It's your genetics of different processes of detoxification. Your liver detoxifies through methylation and sulfuration and glutathione and a myriad of different ways that the liver can detox. Sometimes those don't work as well as other people's, and it's just based on the genetics that you inherit. And so when toxins build up, okay, and what are toxins? Boy, they're literally tens of thousands of different toxins, whether that be heavy metals, and the ones I'm most concerned about are aluminum and mercury, as well as pesticides and plastics and glyphosates and DDT and BPA, and you name it. There's so many things out there that we need to help our kids get rid of, because if it's in your body, it's causing harm. And the faster we get rid of it, the better they'll feel.
And it's interesting because, I feel like in the 70s and 80s, right, you would always hear about, lead paint, right? You would hear like, oh, the baby was teething on, something, and the paint got into, they ate a little bit of paint or somehow, or even the toys back in those days, right? There was lead in there. And we would see consequences to that. The child wasn't doing as well as they should, right? And yet today, it seems as though people kind of poo-poo it, right? It's like they don't really talk about it that much, and yet back then, I feel like they talked about that so much. And then when the new toys came out, we would see, like, especially in the, I would say, early 90s, you would see lead-free, and now even you said BPA, right? I would only say maybe the last 10 years have we really seen where things say BPA free.
Exactly.
So I feel as though as a culture, we're still evolving. We don't understand all of what these things were doing to our bodies and what the consequences were going to be. So now let's fast forward to 1 in 59 children have autism.
Sure.
There is a subgroup of those children that aren't detoxifying. How do we find out, and what are some of the symptoms to figure out that they aren't detoxifying whatever's going on in their body, whether it be from food, environment, them chewing on something that maybe they shouldn't have?
Yeah, and you bring up great examples of, we used to be concerned about, there's lead paint, and we get rid of lead paint. But then all of a sudden stories like Flint, Michigan come up, and look at all the lead that's in the water. Or a story you hear on the news periodically like, this whole set of toys that came from China has lead paint in them, even now in the 21st century. So the stuff is everywhere. And excuse me, the question you asked, which is a great one, how do we find out? Because when there's tens of thousands of different toxins out there, you can't test for them all. So what we really need to look for is test what we can. Okay, so there's different heavy metal tests. You can test your aluminum levels and mercury levels and lead levels and arsenic levels. You can do that through the hair. You can do that through the urine. You can do that through the blood. We also, in our office, we look at a test called porphyrins. Now, porphyrins is a part of our red blood cells that's very sensitive to toxic damage. So you measure those, and the more toxicity there is, the more damage there is. And so it's kind of just a general analysis of this as a problem. Or for some people, and what's hard about toxicity is sometimes there's an acute exposure. Okay, like you licked lead paint off the wall. Okay, there's a worsening of symptoms. And again, when we talk about kids and we're talking about autism, then we're talking about developmental issues or regressions. Regressions in your speech, regressions in your eye contact, regressions in your gastrointestinal functions, and your pooping, and your diarrhea, and your constipation. So that happens with an acute incident, and that's easy to find. Like, my child was like this, something happened, and now they're different. Excuse me. What's hard to do is look at chronic exposure, because chronic exposure is just a long-term event. And to give you an example, I had a kid in my office who was doing his regular lead testing just for school, and all of a sudden his lead levels were through the roof. They checked the house. There's no lead paint. Their house was built in 2000. There's no lead in the toys. They couldn't find it anywhere. Turns out his lead paint was in the ceiling. And it was just flaking off when he's sleeping. He's sleeping, his mouth's open, the lead paint would just fall right into him. Okay? So again, I'm kind of going in a circle here, but we need to kind of find the exposure. And then, if we can solidify that exposure and avoid it in the future, great. But once somebody has that exposure and has it in them, those things take a long time to get out of the body, especially with, as you mentioned, these certain subgroups of people, certain subgroups of kids who have certain genetics that those processes are really slow in the body. So for somebody who might get rid of something in a month, other people might take a year. And in fact, again, I keep mentioning aluminum because it's one of the ones that I dislike the most. Aluminum has a 50-year half-life. That's 50-year half-life in the body. That means if you get an aluminum exposure, okay, in 100 years, you'll get rid of 75% of it.
My goodness.
It's there for so long unless we do something about it. So it's about testing, and then it's about detoxifying.
And so, as people are listening, I'm thinking, or watching, I should say, I'm thinking when my son was a baby, we had, about 1 year of age, we had moved out of our townhouse. We'd bought a new house. We didn't move directly into the new house because at that time we thought, we want to get new paint and we want to get new carpet. And I remember putting my baby on the new carpet thinking I was doing something right. And yet I later found out years later that, there's all this stuff that's like off-gassing from the carpet, and I had no idea. And here, during that neurological kind of development, that's a really crucial age, right? Who knows how much more I put in his toxic overload bucket, right? And so, I know in your practice, you guys are looking at all ages, though. You look at 0 to 99, right?
Sure.
And so how do we help these kids? Like first of all, we get the test, right? Before I move on to that, when you're getting the test, sometimes it doesn't even show that you have an overload because it's hidden in the cells. Is that correct?
Yeah, that's the problem. And toxins love fat. Okay, that's where they live. They live in fat tissue. So when you look at scientific research on toxins and plastics and pesticides, and you mentioned the off-gassing. And again, let me go off on a tangent. Whenever you smell something, you're smelling something because there are microscopic molecules floating through the air into your nose, and then you smell them. So when you open up a new plastic thing and you smell all this off-gassing, okay, it's real, it's tangible. There's molecules there floating around in the air that are then entering your body. And if they're entering your body, they're going to get into your lungs, they're going to get absorbed, they're going to get into your digestive tract, they're going to get absorbed, and all of a sudden they are in you. And you've got to get rid of them. Okay, so back to the testing. Once those toxins are in you, where do they go? Okay, they love to live in fat tissue. So when we look at scientific research about toxicity, it's done through what's called a fat biopsy, where you take this big needle and you take a piece of fat out and you analyze the fat under a microscope or through different testing, and that'll show you what toxins you have. We don't do that on a regular basis, especially with kids. We're not going to be digging tissue out of them. So all we have is urine tests and hair tests and blood tests. And sometimes, like you mentioned, the toxic level is low. And is it low because there's none there? Or is it low because it's stuck in the cells? Or is it low because the toxin that we looked for isn't one of the other 20,000 toxins that's around? Okay, I looked for 10. Those 10 aren't there. But what about all the others? Because there are so many that we need to get rid of.
Well, and it's interesting because I know with our son that when we first did the test to kind of see it looked normal,
right,
or normal-ish, right? And our doctor at the time said we should still detoxify because I don't believe that test. His symptoms were showing otherwise, right? So we treated based on the symptoms, not based on the test. Then we reran the test, I think it was about 3 months later, and this was the craziest part. Those same exact numbers that were nothing, they were off the page. Because now suddenly we opened this kind of like doorway, and there were floodgates, I should say, and it just started dumping, and we had a lot of aluminum, we had a lot of mercury coming out of us. And it took us 18 months of really detoxifying to try to get those numbers to be kind of leveled the way they should be, right? Or I don't think we should have any in our body, but that's just not going to happen in the world we live in. But to where they weren't, toxic levels. And so, when a patient comes to you, and you're testing, are you testing the symptoms sometimes, or are you testing just the test itself?
Well, I'm really glad you brought that up, because you brought up looking at symptoms. You brought up looking at the child, at the person, because in the 21st century medicine, we're relying so much on lab work, and we're ignoring the art of looking at a person and looking at their story and understanding what's happening, regardless of a lab test. So we need to find that balance again, the balance between the art and the science, and it's understanding a person, it's understanding what they're going through, it's understanding what things in the environment can change them and how. And frankly, when we're talking about developmental delays and learning delays and autism, and again, regardless of the diagnosis, it's, those things don't come out of nowhere. Those are not the choice of the child. It happens for a reason. And the toxicity is one of the biggest reasons. That's toxicity that can happen when the child is born, when the child is young. That can happen with toxins that are passed through the placenta while the child's in the womb. So it's really important to, and again, I'm kind of getting off track here as I normally do, but we need to test. We need to detoxify. And like you said, and this is what happens, you can test before you treat, and you might find 0. But then you start treating and you start unblocking those holes. It's like a clogged toilet. All of a sudden we pulled that blockage out of the toilet, stuff's pouring out. So you can start detoxifying and then run the test, and the test will be more accurate. And another thing that you said that I think is perfect, how much is okay? And I turn that question, I look at a reference range on a lab for a toxin, aluminum, mercury, lead, arsenic, and the lab says it's okay to be between these two numbers. I turn that question into, how much poison is okay to be in your child? Okay, so if I have a gallon of bleach, is a gallon of bleach too much? Is a teaspoon too much? How much poison is okay? And for me, it's 0. If those are going to cause the problem in the child, the answer needs to be 0.
Especially if you're seeing symptoms still.
Exactly.
Yes.
Any kind of developmental delays can be from toxicity.
And so now, let's say people are watching and they're like, okay, I want to figure out how to get tested. Let's say we treat the symptoms because, let's talk about symptoms actually. What are some of the symptoms they could be looking for?
Right. Well, anything neurological. So when we deal with regressions, so if your child was talking, was making eye contact, and all of a sudden that's disappeared. It's a story that's shared by tens of thousands of families. That's a symptom, okay? Any kind of intellectual problem or disability, or more of like a comprehension issue or a processing issue, any kind of fatigue. The toxins, again, they go for fat tissue, and our neurons, a lot of our nerve cells are surrounded by this blanket of fat. So all of a sudden, if the toxins go in there, they start destroying the nerve cells. So There's language problems, there's developmental problems, there's sensory and processing problems. When it's really bad, you can have seizures. They start to affect the mitochondria. The mitochondria stop functioning. You've got anxiety, you've got psychiatric issues, whether you have a diagnosis or not. I'm anxious, I'm depressed, I'm a loner, I'm angry. It starts to get into the GI tract, the mitochondria of the GI tract, so now that's not working, you have constipation. It can affect almost any part of the body.
And I know even as like my son, he was looking, he was babbling, then talking,
Sure.
and then suddenly he wasn't looking,
Right.
and he started getting eczema and all these different rashes, and
Right.
and wasn't getting really colicky, and everybody was saying, oh, that's just being, he might be teething, or that's just, toddler time. And I think it's important for families watching to realize when it doesn't feel right in the gut, meaning as the mom or the dad's like instincts, then find a doctor like you.
Right.
Because I feel like the earlier we do it, the better, right? However, if your child's 2, 52, 92, I think that at any moment you can try to help. So now let's talk about how they find the symptoms, they get tested, they find you. What are some of the things we do to help with detoxification?
Well, number one is you want to avoid any current, toxicities. You want to make sure that your house is as clean as possible, okay? Number two, we can do small things that start to help with detoxification. So eating certain things, things like onion, things like garlic, things like cilantro, those are easy dietary things, or for kids who have very sensitive palates, maybe not so easy. A lot of people will do Epsom salt baths, or different type of clays. So those are all good small things to start with. In our clinic, we start really advanced types of oral supplements that will help get rid of these toxins. Because again, if this stuff is going to be in our body and brain for decades, if not a lifetime, we really need to be aggressive to get this stuff out. Because the sooner we get it out, the sooner it stops hurting us and hurting our child and killing brain cells. So we really need to get it out as soon as possible. And so we use different natural supplements that will help bind things in the body. We're a big fan of chlorella. We're a big fan of different homeopathics. I just put together a new homeopathic. We got FDA homeopathic approvals on it, and it uses a certain homeopathic substance called calcium oxide. Now, calcium oxide is what the wastewater treatment industry uses to detoxify aluminum, because water systems, our water that we drink, can only have a certain amount of aluminum in it because it is toxic, it's poison. And so when we get our drinking water, it has a very low level of aluminum in it. And they make sure of that by using this substance called calcium oxide. So we've formulated this brand new supplement that has homeopathic calcium oxide, binds the aluminum, gets rid of it. So it's amazing stuff to help clean your body out.
How fast do you see typically, I hate to use the word results, but results of a child who may be exhibiting symptoms? They then start to detoxify. Does it range per person? Do you usually see things faster? Do you see regression before you see the child getting better?
Right. So depending on the type of detox, sometimes you see regression first, sometimes you don't. When you see regression, it often means there's a reabsorbing going on, because there's 4 ways we get rid of stuff out of our body. Okay, we pee it out, we poop it out, we breathe it out, or it comes out through our skin. Okay, if you ever drank a lot of college and you woke up, you're like, oh, my skin smells like alcohol. It's alcohol. And so for our kids, primarily it's through the urine and through our poop. And a lot of our kids are constipated. If they're constipated, they may not be removing the toxins fast enough. And that's when you start to see these kind of regressions or die-off effects, as they call them. So if that happens, you're detoxing too fast, faster than your body can handle. And what you want to do is just kind of cut down. The protocol that we use, we haven't had any of those kind of effects yet. And again, this protocol is pretty new for us. We've been doing it for a couple months, but most of our parents within 4 weeks have seen more language, which is great, because getting more language is one of the hardest things with our kids on the spectrum. We are starting a new research study, and we're testing our new protocol with kids, and we're going to be doing before and after ATEX. So we're really excited because it's brand new. It hasn't been used before, and it's got such great potential. And so far in my patients, we're getting more language, and that's such a big thing for so many families.
And just for those watching, ATEC is the Autism Treatment Evaluation Checkoff List. It's super easy. I think you go to, is it ARI? .com or .org, one of those. It's one of those. If one's wrong, try the other one. And basically, it doesn't cost anything. It takes about 5 minutes for parent to kind of do the questionnaire online. They email you the results. The lower the number is, the less, I guess, I hate to say the word, higher functioning, or less of the diagnosis, whatever you want to say. I don't know the politically correct word way anymore. But the lower the number is, it just means the easier it is for the child to be able to function in the world. And the higher the number is, the more aid and help that child needs. And so as a parent, we always want that number to be lower. And what's neat about that, when because I use that test all the time, especially if you're trying something new, and that's the only thing you're doing, it's really recommended to take that evaluation before you start the protocol, and then maybe 3 months later to then take it again and only do that protocol. Like, don't do other stuff, because then you can really see what's working, whether one way or the other. So I love that you're doing that in your office. Now, how do people find you?
Well, go to our website. Our website is spectrumawakening.com, and you can reach out to us. You can make appointments if you want to be our patient. You can get this detoxification protocol on our website. But one thing that I do that I encourage everybody to do is every Thursday I have a Facebook Live. And so I pick a topic and I talk to everybody who's there about the topic, about autism, whether it be the gut, whether it be the diet, whether about detox and brain chemistry and hormones and mitochondria, you name it. We talk about a topic, we answer live questions, and so it's a great way for me to engage with any families and again around the world. So, every Facebook Live, we've got regulars from South Africa and Sri Lanka and London, across the US. So, if you want to learn more, that's one way that our clinic is helping families learn about what they can do. So if you wonder what you can do, then check out our Facebook page, Spectrum Awakening, and we're here to help.
And on Thursdays, is there a certain time that you do it?
It's my lunch hour, so I'm Eastern Standard Time, so I'm near New York City, so it's 12:15 Eastern Time. But we keep them up on our Facebook page for eternity, so you can go and listen to anything that you need.
I love that. Now, for families watching right now that just feel like maybe they feel a little bit lost and they still don't know where to turn, right? And again, they could be starting their journey for the first time, or they could have been on their journey for over a decade, right?
Yeah.
What message do you have?
Well, never give up hope. There are so many naysayers out there, whether it be your pediatrician, whether it be the teachers, whether it be your family, that say, you know what, your kid's going to be like this forever. And that may not be the case. Whether it be my practice, whether it be the other biomedical docs out there, we have helped kids recover. And we want to do that for everybody. We want to do that for every single kid. We want to help them be their best. Whether we can help your kid be 20% better, 50% better, or 100% better, there are so many things you can do and so many things that you can try. So don't wait. Do something now.
I love that. And again, guys, if you're watching, when we say be better, that means we want them to have the best quality of life. We want them to feel good, and that's really what it's about, so they can do good. So thank you so much for being here.
Kristen. Great to be here.
And for everybody watching, thank you guys. Until next time. Bye, guys. All right.